Assalamu alaikum everyone. Today the topic of discussion is sideroblastic anemia, which is a type of microcytic anemia. This type of anemia is caused by defective heme metabolism, which leads to iron trapping inside the mitochondria. On the basis of etiology, it classifies an inherited and acquired. Inherited anemia is X-linked and it is due to delta amino levulinic acid synthase gene defects. Aminolevulinic acid synthase enzyme is involved in the conversion of glycine and succinyl-CoA to aminolevulinic acid. So the heme synthesis is impaired. Okay, this was the inherited type and we have also acquired type. So acquired is due to vitamin B6 deficiency. Vitamin B6 is coenzyme in the heme synthesis. Also alcohol, and we have drugs which are chloramphenicol, isoniazid. Isoniazid leads to deficiency of vitamin B6, which is a coenzyme for the heme biosynthesis. And we also have linezolid. So these are the drugs. Also in copper deficiency, myelodysplastic syndrome, and malignancy. These are the causes of sideroblastic anemia. Now about the diagnosis. So first we do CBC. We will find microcytic anemia. Then, as we have discussed earlier, that in microcytic anemia, as initial investigation, we do the serum iron studies. So what will we find here? We will have high ferritin, high iron, and high transferrin saturation. This is the only anemia having high iron, because iron cannot get into the heme synthesis. So iron accumulates in the mitochondria and iron level increase. So we will have high ferritin, high iron, and high transferrin saturation. But we will have low or normal total iron binding capacity. So these are the main points which you should remember. And then we do peripheral smear. So what will be on the smear? Basophilic stippling of the RBC. What is basophilic stippling? So these are the basophilic. So these are the small. So in basophilic stippling, we found small basophilic granules which contain ribosome and remnant of RNA as a result of impaired cell division. Surrounding erythrocytes appear normal. So you will find the basophilic stippling. And on Persian blue staining of marrow, you will find the ring sideroblast. What is ring sideroblast? So these are nucleated RBC precursors with perinuclear ring of granules, and these are most likely granules of iron. So these are iron granules that have stained a bright light blue with an iron-specific Persian blue stain. Several nucleated RBC are also visible at the periphery of the image. Perinuclear ring of iron granules in a red cell precursor is the characteristic appearance of the ring sideroblasts. These are the ring sideroblasts that you find on the Persian blue staining. So these are the two findings, which are basophilic stippling and ring sideroblast seen in sideroblastic anemia. And now, what's the treatment of sideroblastic anemia? So cessation of the offending agent, the causating agent should be stopped, and pyridoxine B6 supplementation, because it's a cofactor for delta amino levulinic acid synthase. So that's all about sideroblastic anemia.